Well, changes to the rules around billing for virtual care appointments in Ontario could force the closure of the province's only clinic that offers virtual gender-affirming care. Healthcare providers can now only bill around $20 for a video consultation and $15 for consultation by phone, unless a previous in-person relationship has been established in the past 2 years. But that's a problem for clinics that are run entirely on a virtual platform, like Connect Clinic. And Dr. Kate Greenway is the founder and lead physician at Connect Clinic. She joins us this morning. Great to have you here.
Good morning.
Let's outline how these changes to the online billing affect a clinic like yours.
Yeah, so prior to these changes, we were operating in a fully virtual format, even prior to the pandemic. We've been seeing all of our patients from across the province through consultations by video link, but now we actually can't afford to run our clinic, right? Because we've been able to bill regular billing codes, and
Which
now
is around $60 to $80?
Yeah, it's around $70 for a 20-minute appointment, and ours are usually at least 20 minutes, our appointments.
You are currently looking for funding to try and keep the clinic's doors open. What happens if you don't get the money you need?
Yeah, if we're unable to secure other funding outside of the ministry billing, then we won't be able to continue. The clinic will close. Currently, we're already operating at a much lower capacity, only seeing urgent issues and prescription renewals because we can't afford to do routine care for our patients.
How many clients does that affect?
We currently have about 1,500 active clients. Yeah, and we have another 2,000 on our wait list that we have no way of seeing.
And what happens to all of those clients if your clinic isn't there?
We're in a really difficult position because the patients came to us because they didn't have any other options for gender-affirming care, and so we actually don't know where to send many of them. I was speaking to someone in a rural part of Ontario yesterday, and we really just couldn't develop a plan for where they would go next.
And is it because the kind of care that they need isn't offered in other clinics or hospital settings?
So there's a number of clinics across the province that do gender-affirming care in person, but they tend to be in not in rural settings. So they're in these urban centers, in particular clinics. So my patients who are in more rural settings or more remote, who can't travel to get to these clinics, really don't have any access in their own community. And that was the sort of niche that Connect Clinic was filling. We were seeing people who just couldn't travel to get to these clinics.
And for people who aren't familiar with the term gender-affirming care, what does that include?
So gender-affirming care is a number of different care modules that you could, for people who are transgender, gender diverse, non-binary. So it could include hormones, it could include surgery referrals, or just general health care and support for people who are questioning their gender identity.
So we reached out to the Ontario Ministry of Health to comment on this new rule change. I'm going to read to you what they said. They said virtual care is intended to complement in-person care, not replace it, and our patient-first approach to the new virtual care framework ensures Ontarians will continue to have access to convenient and appropriate care. Is that true in your case?
No, absolutely not. So virtual care is really important for this population for two reasons. One is, as I already said, we have a lot of rural and remote patients who can't access in-person care for gender-affirming care. And the second is that virtual care is actually a safer way to access care for many trans and gender diverse people because they don't have to go through other parts of the healthcare system to connect with the provider. So they don't have to, present their OHIP card at a healthcare facility that might not use the right name or pronouns when they're addressing the person. There can be lots of experiences of transphobia within the healthcare system. So ours help people avoid that. They can connect directly with a provider that they know is culturally competent to provide care. So there's really two issues there, right? There's the rural and remote populations that don't have an in-person option, and also just the safety aspect of virtual care.
I want to thank you for coming on your morning and drawing attention to this story. And please check in with us. We'd like to continue to see what happens.
Sure. Thank you so much.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.